Just kind of talk to you about the program. If you're an employer, what you need to know. If you're an IMG, what you need to know, and we'll be taking questions and trying to give you the best information as we can to help everyone um, be successful. So, Marissa, welcome. Please take it away.
Thank you. Thank you, everyone, for having me. I'm very excited to talk about this license. It has been my very first creation as the licensing manager to create a license with the medical commissions. So it's kind of my baby. So I'm very happy to present to you. So I will go ahead and get started. And feel free to ask any comments, like Mohammed said, and we will get to your questions soon. So all right, is everyone able to see my screen okay?
Yes, I can see it.
Okay, perfect. All right, so today we are going to be discussing our physician and surgeon clinical experience MDCE license. Our objective today is to explain the history of the MDCE license and give you a brief summary of the application process, our requirements, and approval time. We're also going to be clarifying the nomination process, who can nominate, what does a typical nomination letter look like. We will be discussing the practice agreement requirements and what information is needed to complete one online. And we're also here to define the WMC's criteria for an appropriate medical practice. We'll also be summarizing the benefits of obtaining an MDCE license with Washington and provide an opportunity for questions. So what is an MDCE license? Well, in 2021, the legislature passed the Substitute House Bill, or SHB 1129, to create the limited license to practice medicine for international medical graduates who meet a certain criteria of requirements to be able to practice in Washington and gain clinical experience for 4 years. The Washington Medical Commission, or I'll refer to it as the WMC, created the Physician and Surgeon Clinical Experience License, or MDCE license, after the bill was passed, and the applications went live in October of 2021. Since its inception, the WMC has received about 76 MDCE applications, and so far have granted 36. Average processing time for our MDCE license averages around 3 to 4 weeks. We definitely have issued them quicker. I believe in the first year we were able to issue it within 5 days. Then it went to 12, and then now they've kind of really integrated into our normal licensing process. But it definitely varies within our time of the year. April to July is when we're typically in our peak season, so if it's avoided, or it could be avoided, please try to apply either before April or after July, just so you're not experiencing that volume. But again, we try to make sure that you guys are a priority as well, and do our best to shorten that time frame. How do I qualify? So each applicant must be a resident for at least 1 year prior to applying. We actually request proof of residence with that. Now, I believe in our application we reference having a state issued ID or driver's license or a voter registration card. Well, sometimes that's not as easy to obtain, or you may have been a Washington resident prior, but just didn't get around to switching your ID or getting your voter registration card updated within that 1 year mark of applying. So we've done other things previously as well. So we've accepted rental agreements that show that you signed a rental agreement a year prior to being an applicant, or we've accepted power bills or some type of utility bill that shows that you established a resident in Washington, prior to applying 1 year, before. In order to qualify, you must obtain a nomination letter from a hospital or an appropriate medical practice located in Washington, a county or city health department, or a Washington state agency. A letter must be submitted by the facility or the organization. It cannot come from the applicant. I will, in a later slide, we'll go over more of the nomination process and what that letter will look like. So we'll move on for now. You must pass all 3 steps of the USMLEs, which I believe in our bill review, we're in the process of submitting a new bill that may change it, so you only need to qualify with 2 of the USMLEs, step 1 and step 2. And it's a requirement that you will need to also hold your ECFMG certification, so that aligns with, only needing to pass step 1 and step 2 to get that certification. So that's something for the future, but as of right now, we require all 3 and then your ECFMG certification. Lastly, you must establish an agreement between your physician at the nominating location who will provide oversight supervision. And a practice agreement must be approved prior to practicing. So it's actually part of the application process. We cannot grant a license without a practice agreement in place. It will actually stop our licensing system and have a big error. So we need that in place in order to be able to grant you a license. So this is what I was talking about previously, our nomination process. Who can nominate? So nominations can come from a chief medical officer or director of any hospital, appropriate medical practice located in Washington, DSHS, Department of Children, Youth, and Families, Department of Corrections, or any county or city health department. The letter must state the applicant's name and the facility or organization that is going to nominate the applicant for the license. And then the letter must also have an official start date of the applicant's employment. Providing the name of the supervising physician isn't required, but it's desirable. So we have a cross-reference whenever we receive that practice agreement. So here is an example of what a previous applicant has submitted for an MDCE nomination letter. So it, references our RCWs in regards to the limited license. It touches on the WAC. It tells us the start date, and it lists the actual physician that the MDCE will be supervising under or supervised under. This is what we kind of look for. We also have a different example of what we received in the past that still has a different look, but it still contains the same information. So again, nominating, start date, who they're going to be working under, just something that kind of gives us an idea. And then as you go into the practice agreement, that's when you'll go into more of the meat and potatoes of what the actual provider will be doing. So our next slide talks about that. So in the practice agreement, each applicant must submit a practice agreement with the designated supervisor of the same or subsequently similar clinical specialty as the supervisor. So let's say that you had a history of practicing in general medicine, but then you have a doctor who specializes in cardiology. That may not work in this type of case, because we want to make sure that you have the training, because you are technically a physician and will have more independence in this work. But you want to make sure that you are in the similar training that you received, or that they're going to provide you with adequate training for that. The commission must review and approve the practice agreement before the license is granted, like I mentioned before. So the supervising physician can supervise no more than 2 MDCE license holders unless granted by the commission. We have had one organization so far that has been approved to supervise up to 10 per MD MD or physician at their practice. So we have already received a request for an increase on that, and the commission was willing to approve it. And so we just need to know why. So in any of those requests, we would just ask that the provider or the supervisor tell us how they feel they would be adequately able to supervise more than two, and give us kind of a layout, and then it goes to the panel for approval. The supervising physician shall retain professional and personal responsibility for any act that constitutes the practice of medicine as defined in RCW 1871-11, or the practice of osteopathic medicine and surgery defined in RCW 1857-001, when performed by the international medical graduate under their supervision. So it's similar to what a physician assistant does in regards to you need to have a supervisor, you need to have some type of practice and plan, but you are not categorized as a physician assistant, you are categorized as a physician under this. Okay, what information do I need to provide in a practice agreement? So we have an online portal that is on our Department of Health, Medical Commission website. It will require some fields in that portal. So you'll need to know the applicant's name and license number if available. It's not starred because we do have providers who apply and have their practice agreement already ready, but they just aren't assigned a license number yet. So if applicable, please provide that. It's not important without it. I mean, it's not important if we don't have it. We'll also need contact information and medical specialty. Same goes for the supervising physician. We would need their name, license number, and contact information along with their medical specialty. We would request that they list any alternate supervisors that would be available and would be designated if the supervisor is out of the office or needing to take medical leave. We always want to make sure that you have a backup. And then we would want a brief statement, including the scope of practice and general clinical duties that the applicant would be performing. They would also need to select the appropriate statement for sponsoring relationship in the collaboration, or create one that is not listed from our thing, and I will show you in the next step. Once submitted, the portal actually will email you a copy, and it will email the commission a copy, and then we will add that to the application in our system before the license is issued. So here is an example from our portal, the sponsoring relationship. So it will kind of give you already a breakdown or an example of acceptable sponsoring relationships, and you can just pick from those. Or if you already have some type of layout that doesn't quite match what we've already listed, then you would just feel free to write it in the other section. But so far, it seems like one of these already listed has been appropriate for what we've seen so far in our facilities that have already nominated and successfully hired some of these MDCEs. So I mentioned the appropriate medical practice before. So a criteria for an appropriate medical practice for Washington is a facility that is obviously physically located in Washington, and it must provide clinical care to Washington patrons. There are two options for practice site requirements. One can be operating within a federal system, such as the military, Indian Health Service, tribal health, or community health center, or they can be option two, which is what we typically see, where it's just a location that has 3 physicians on staff, at least 3, and they can be MD or DO. They need to also deliver direct patient care and participate in a quality review, improvement, and assurance programs. So that is typically our biggest option. I do not recall us having a license that has been granted to anyone in option 1, but I could be mistaken. So yeah. Now the benefits of this license. This is the first license in Washington that was created specifically for our IMGs who reside in the state and are able to practice clinically with supervision. The MDCE license is valid for 2 years from the date of issuance and can be renewed one time, which makes the lifespan 4 years. Our traditional licenses and other limited licenses usually are valid up to 1 year from the date of issuance, so it is a little bit different than our normal licenses. The hope and the goal of this license or for this license is that after practicing up to 4 years clinically, the IMGs would be able to match into and complete a post-grad training program that would be allowing them to be able to convert over to that full MD license in the future. This license will allow more IMGs to get back in the field and provide medical care to our patients in Washington. Now, I didn't have an official slide that talks about our new bills that are coming up in the future, because again, bills are already submitted, but they don't always follow through, or there's cutoff. So I didn't want to put it in writing, but I do want to tell you that there are a lot of things coming this new leg season that are going to hopefully change and improve our MDCE license. Currently in works that I know of is that there's still being a bill to present that will extend the lifeline of the MDCE license, that will allow this to be renewed up to 3 times, which makes the lifetime of the license a total of 8 years instead of 4. There's a couple of other things that our IMG work group and Mohammed and a few other people are working on to just improve it and see if there's things that we can do to make this more successful. So just keep an eye out on those. I'm sure Mohammed's team will be keeping you guys updated as things move along. You can always sign up for our newsletter, because once things pass, we will be blasting it on our website and in our newsletters to just celebrate things as things happen with these new changes. So with that, here is my resource page in regards to where you can get more information about our clinical experience license, our practice agreement portal, and then the bill and our RCWs if you have any questions on that. I'm happy to send out the slide deck as well, just so you have the links if necessary. Here is my contact information, and I'm always happy to answer any emails in the future if you don't have any questions for me today.
Thank you so much, Marissa. And also, we'll be emailing the slides. If you registered, and I'm sure everyone registered for the event, we'll definitely email the slides and send it to you so you guys can review. So please send in your questions. We're getting some questions right now, but we'll start with, and Marissa, we'll start with some of the questions that we got offline. And the first question was with regards to alternative physicians. When someone is applying through a clinic somewhere, and so if the clinic, how many alternative physicians does the clinic have to list on their practice agreement or their nomination letter?
So I believe in our practice agreement, we either have, like, you can list 1 to 2, or you can put the physician group. So you don't have to necessarily designate someone. It could just be, okay, we at least have a supervisor up front that's saying that they will take over. However, if that physician is not available, the MDCE can go to any practitioner in our practice and get support. So they can either be one specific, or they can put the group practice, and that's fine.
Yeah. Awesome. So the second question is, does the medical commission regulate malpractice? There's been a lot of confusion on that.
Yes, that has been a lot of confusion. No, we do not regulate, and I don't believe, Mohammed, correct me if I'm wrong, didn't they technically remove that standard, or is that still in place?
They removed it. They removed it. So I think in the original bill there was malpractice, and then And then there was removed after that. Jose, do you have a question? Oh, I think so. You're on. Okay, or you can go on mute, or you can put your questions in the chat. Um, awesome. So the third question. So now we'll go to the chat. Jazz had a question. Do MDCE physicians get an MPI, or is that something they have to do on their own? Can MDC physicians register for CME credits?
Great question. We don't typically handle the NPI process, but I do believe I've been in contact with a recent provider who was able to was granted a MDCE license just, I believe, last week. And so they reached out in regards to their the code that they needed for credentialing that I think is specific to applying for an MPI number. So I believe that they can. Again, I apologize. That is not something that the commission handles, so I'm not very knowledgeable in that. But I do believe that our MDCEs are able to request CME credits as well. I believe with our license, they're automatically enrolled in that HEALWA resource, which is through UW. They can always register with that. It's a service that you pay with your application fee and your renewal fee, and it's service for CME credits as well. But it's not a requirement that you have to report any for this license type. I would like to point that out, that we do not ask for CMEs for this license like a lot of our limiteds. We do not ask that.
And also, can you talk about the renewal process? Let's say you're with one employer during the middle of your 2 years. How does that work? And you kind of switch to another employer.
Yes. So whenever you are switching to an employer, please notify us as soon as possible. The limited license, the structure of it, because you're nominated by a facility, your license is tied to that facility. It is not one that follows with you anytime you change employer. So notify us as soon as possible. Depending on when your renewal falls, let's say you notify us and your expiration is going to expire in 30 days. We will just transfer your nomination or your license to that new facility, but we would need a new nomination letter. But like, let's say, and we've had this in the past where you decided to leave your current employer, let's say in January, and you said, I am not actively practicing right now. I'm going to be looking for another location to sponsor me, and it takes up to a year. We technically would need to terminate your license at that point and have you kind of go through an application process, at least nomination again, and a practice agreement to be able to update your practice location and transfer that responsibility to the new location. However, as of right now, how the bill and how our license works, it doesn't extend that time for your license. So again, if you are switching employers, just let us know immediately. But if there's a gap, it may not extend your license lifetime. So I want you to make sure you are able to practice as much as possible under this license and not impacted if there's a gap. But if there is, contact me. I want to make sure there's something I can do to help you, but there's not always a guarantee that we can extend it unless obviously that is passed with the new bills that are in place.
Awesome. And Barbara had a question. Do you have any data on the number of employers that are hiring MDCE doctors?
I don't, unfortunately. I just know of the facilities that I've seen come through the application process. I think as of right now, I have maybe 6 different locations. Most of our successful MD programs are within one organization right now, but we're hoping with more education and more questions that are out there that will expand. I know that we are in talks with UW as well, and they're interested. So there may be more happening this year that will allow people to open up and offer more positions to our IMGs. under this
Yeah.
license.
Yeah, and like I can answer that question as well because we get a lot of employers reaching out, and we connect a lot. We've been connecting a lot of employers, and we've been working with Marissa to get a lot of people in the application process. So yeah, Barbara, there are many opportunities, and it's growing. It's a new license, so but we're seeing new employers adopt this every day. So, and if you're an employer and would love to learn, yeah, let me know. I'll be happy to work with you. So, and Mahdok had a question, and the question is, what is the schedule of doctors with a temporary limited license? Is it based on the provider being inpatient, outpatient? I don't think Marissa can answer this question. So yeah, the schedule, but I can. So basically, it depends on it depends on the employer. You know, most of them have 9 to 5 jobs. Some of them have evening jobs. Depends on like if you're doing urgent care, what type of job you're doing. So it depends on employer to employer. So next question is Jazz. Um, do you recommend IMGs to choose their supervisor, or is that thing that WMC prefers to make?
No, so we stay completely out of it. We cannot recommend, we can't do anything. That is something that when you're ready to apply, you should already have an employer and a supervisor already established. Typically, that is something that you talk about in your interview process, or when you're accepting a position. There, you should already have a supervisor lined up for you, or like a small number that you can choose from, or that matches like the specialty or the type of work that you would be doing. But no, unfortunately, the WMC has to stay out of it. So that is something you would have to do on your own with your
Yeah,
employer.
and Jazz, we can give you some recommendations on basically the best type of relationship, like especially a supervisor relationship, and contracts, help and all that. So let us know. We can always help you with that. So next question
Thank
is
you.
of course, of course. Next question is Idris. Is there a chance to get a license with a couple years of MDCE, basically without residency?
So that was our hope with the initial license or creation of this license, was that this could be another pathway. As of right now, how it stands, unfortunately, after that 4 years is up, you would have to match with someone to get additional residency or a fellowship to qualify for the full license. But we do have another pathway that a lot of our IMGs are looking into, which is our clinical experience license that can waive the 24 months of ACGME accredited training. So while the MDCE license does not transfer you over to a full, we do have other ways, other pathways as of right now to help. And then again, I believe some bills either this year or in 2026 that are hopefully helping to establish something for our MDCEs as well.
Okay, nice. And I see Mike is here. Micah, welcome. Yeah, please chime in.
Sure. Just to clarify on what Marissa was talking about. So just to be clear, right now, the law, as the law stands, the clinical experience license will only last for 4 years and then it expires. We're coming up next year on the first round of folks that would expire, and I'll address that in a second. Right now, there is not a pathway with the MDCE license to get a full license without a residency. That's something that we're addressing. So Dr. Khalif, you and the rest of the work group members are going to be receiving an email today with the 3 bill drafts that I finally have pulled out of the code advisor's office. And so the 3 bill drafts for the folks that are on there are as follows. The first one revises the requirements of the clinical experience license. It extends it to 8 years of validity. It removes the requirement for Washington residency. It removes the requirement for USMLE step 3. I think that's and then it adds a section that specifically defines the scope and role, and specifically calls out that the holder of the clinical experience license may be credentialed in hospitals, may bill insurance, may have malpractice coverage. So we really are trying to be specific and get that positioned so people can use it and more groups can use it, and not have and smooth over the bureaucratic hurdles between the institutions. The second bill is one that is requesting provisional funding to establish four-year residency positions. This is contingent on getting a national residency match program waiver for the state. And it's based off of an innovation where the first year would be a transition year for MDCE license holders, and then they would matriculate into the rest of the residency. The residency categories are what you would expect. They're more, general practice, family medicine, peds, psych, OB. I think general surge is on there as well. The third bill, and this is really what we're talking about with the pathway piece with the clinical experience, is one that does a couple of things. First, it would establish a hardship waiver pathway that the medical commission could consider hardship and be able to grant a full license based off of that and waive various requirements in statute if needed. The second piece of that is to establish a 4-year apprenticeship pathway to full licensure. And I'll just go ahead and say that and give a shout out to Pacific Medical Group, who has really been pioneering this and opening our eyes to how this could work. Dr. Stan Fleming over there is really pushing this forward, and I really appreciate his work on that, along with the MDCE licensees that he's employing. So the bare bones of it is you have a MDCE license and you go through a 4-year structured program of supervised practice. You have to meet certain CE requirements or CME requirements. You have to go through and have documentation of all of the various pieces that you're doing. And this is according to a curricula and structure that is put together by the American Academy of General Practice. Notably, the Medical Commission does not typically recognize any boards outside of the American Board of Medical Specialties, and there's a lot of good reasons for that. This would be an expansion of that consideration should it pass in law. But those are 3 bills that we're hoping to see come forward in the 2025 session and really open up and harmonize some pathways and bring some equity to this process.
Thank you so much, Micah, for the explanation. And for those of you who don't know, Micah is the Deputy Legislative Director. Is that right, Micah? Is that your title?
Deputy Executive and Legislative Director, yeah.
Deputy Executive and Legislative Director at the Washington Medical Commission. I should have known that by now, but I always get confused with it. And yeah, thanks, Micah, for explaining that. Also, Mike, can you explain the exceptional qualification waiver? A lot of people have been asking me on that. I know Marissa touched on it a little bit. Yeah.
Yeah, so the exceptional qualification waiver process came through in 2020 with Senate Bill 6551 that started the work group and really kicked a lot of this off for a 5-year process. And so really what you need to think about it is we've got limited authority to waive things that are in statute that are requirements for getting a full license. And for better for worse, at this point, most of the requirements to get a license are in statute. There's some movement on this, but the exceptional waiver really is, we're not asking you to apply first. We're asking you because we don't want you to get in this pathway of you've applied, you want to go the exceptional waiver route, and all of a sudden you find out you're not qualified and you're in a license denial position. We don't want to put anybody in that. We also don't want you to be putting the money that involves getting a license application going forward. We'd rather have the waiver answered first because that's free. And so what you do is under various categories, whether it be research, exceptional employment. Marissa, I always forget the third category.
Research, employment, and
it's body of work. Is it body of work?
Yeah,
like
if you've pioneered like a procedure or something, so that kind of thing. And so you submit your CV, your ask of getting an exceptional qualifications waiver under one of those 3 categories, submit the evidence for that, and then we take it to the commissioners, which on what we call Panel L, or the licensing panel, and they consider whether to grant the waiver. Once the waiver is granted, you get that in writing, and you use that to submit your application with the waiver in there, and that waiver serves to waive the 24 months of GME. So if you haven't had that and you're exceptionally qualified, then you would get the full license that way. I will say the only real drawback, or not even, I'm not even sure I would call it a drawback, but just the caution is, when you haven't completed 24 months of CME or a GME, that usually means that you're not going to be able to be board certified. You may run into some issues with respect to getting credentialed in a hospital or getting on insurance plans. But a lot of the times that we see these folks, they're going into.
Can you please turn off your Bluetooth?
Hello?
Yeah, it's Faye. I think you're on mute. Somebody forgot to be on mute.
Yes.
Okay, let me put them on mute. Somebody forgot to be on mute.
I hear a younger participant.
Go ahead, Micah. Yeah, if you're not on mute, please
Yeah.
be on mute. And peace. If you see somebody who's not mute, you can mute them since you have. All right, go ahead, Micah.
Yeah, sure.
No worries. Yeah, so basically, a lot of times we see these exceptional qualification folks coming in and going into an academic setting, so it's less of a concern with the board certification piece, and there is a higher number of international medical graduates who are working in those settings anyway. I think one of the examples we got during this last legislative session was the Department of Anesthesiology at UW is chaired by a German anesthesiologist who's not board certified but exceptionally qualified, obviously, and then about 40% of the Department of Anesthesiology is IMGs.
All right, so we can move on. We're getting a lot of questions, so we can just move on. And so the next one, I think Marissa or Micah, both, anyone can answer. What happens after the 4 years is expired, and if I don't match to a residency program, is there like any route after that?
There really isn't as of right now. There are things, again, that Mike had spoke on, what we are presenting and things that are going to come down the pipeline to be able to assist. But as of right now, for our MDCs, that, if things don't improve, unfortunately, they would have to resort to something else, like possibly a fellowship, if they are able to at least get something through UW or Wazoo. We do have a teaching and research license that a lot of IMGs have been able to utilize as well. But unfortunately, there isn't anything in place right now that will allow that to extend right now.
Yeah, and we're definitely working on this legislative session, as Micah just pointed out, to do some things. So next question is from Jose Aranda. Jose says, this is the first time I'm hearing about the MDCE. I reside in Mexico, finished my step 3 and applying for an EB2 visa. Part of my application, they recommend a letter of recommendation for regulatory authorities, basically saying that I meet basic requirements for the license. Could this be possible? Basically, can you help with any immigration stuff? I think that's the question. For any letter of recommendation. Jose, if I didn't say your question right, you can come off mute and maybe you can ask. But yeah, the way I'm reading the question is he needs an LOR for regulatory authorities and if this is possible. So
yeah. I've never done this before. I don't know if that's something that we technically handle.
Micah has his hand up as well.
Hello, yes, this is Fernando Aranda, Jose Aranda.
Okay, go ahead, Jose.
Hi, thank you. So just a little bit of context. I'm applying for an immigrant pathway with an EB2 NIW visa to be a permanent resident in the United States. As a general practitioner, I'm allowed to do that. I have more than 7 years of practice. So basically, to improve my application, they asked me emails of letter of recommendation by regulatory authorities, basically in this case, the state of Washington, saying that I could be a candidate to apply for that visa will be more than enough. So my question is if this is something that you could help me out, having this type of visa saying that I have basic requirements if I reside in the state of Washington.
Yeah, I mean, you can certainly send me an email. I can put my contact in the chat. It's not something that we've typically done, but we have had applicants who at least needed to start the application process just to have something on the record that they are here, they meet the qualifications, and we've confirmed that. But I'd have to look into it a little bit more, but I'm happy to if you just want to send me an email.
Okay, thank you. Will do.
Yeah.
So I just want to tag on to that. We do not do letters of recommendation. There's a history here that the legislature has tried to put forward, and it's basically doing kind of like a pre-approval process without the application. And it gets into legal issues like property rights and due process and that sort of thing. Typically what I've seen with immigration visa requests is it's done by the employer, and it runs through their shop, and they will validate that you've met some qualifications. Without seeing an application, it's pretty much next to impossible for us to determine that you meet the qualifications. And the only really legal aspect that we have there to say yes or no is if we issue the license.
Awesome. So the next question is from, oh yeah, sorry, Jose, did you have a follow-up?
It's okay. Oh, I understand. Thank you for the information.
All right. So the next question is from Angelis, and Angelis says, when is the 2025 legislative session, and when do you think basically these changes are going to happen, if they happen?
Sure. So the legislative session, it's going to be a long session this year. So it's going to run from, I believe, January 13th through the last week of April. And so anything that passes, depending if there's no effective date, it'll just be within 90 days of the end of the session. So let's April, May, June, late July. Sometimes they have emergency clauses where they immediately go into effect upon signature. Sometimes they just say July 1 is, that's usually a budget bill. July 1 is where it happens. So that's the schedule.
Yeah. Okay, and next question is, I think I can answer this question. Does the WMC review employment contracts? No, but we do. We'll definitely be able to review your employment contracts for you. We have a lawyer on that we work with, so definitely send Idris, if you have a contract, send it to us, and we can help you with that. Sounds good. So is there any other questions? I want to ask you one other question that we've been getting, but if you guys have 10 more minutes, feel free to, send your questions. So one question that we've been getting was around step 3. There's a lot of IMGs who have done their step 3 maybe 10 years ago or something, or maybe 8 years ago. Is there like a time frame that they have to do their exams?
So within our rules, it just states that they need to be completed within 7 years. However, we have the authorization to waive that or review it additionally, as long as we have some type of statement and a reason why. It hasn't really been an issue with our providers, though.
All right. Any more questions? I don't see any more questions. I think everybody's good. Okay. All right. With that, then we'll end the webinar. Thank you so much, Marissa and Micah, for coming on. We really appreciate your time, and looking forward to the next one. And please spread the word, guys. If somebody couldn't attend, we'll have another one on Monday. But thanks again, and hope you guys have a great week.
Yeah, thank you. Thank you, everyone.
All right. Have a great day.
Bye.